A very good afternoon and welcome to the 85th Continuing Medical Education event organized by the Faculty of Medicine, Biosciences, Nursing, Masa University. Today's speaker is Professor Dr. Srikumar Chakrabarti. Prof. Srikumar is a pathologist with 25 years of experience, and he's currently the Director for Research, Innovation, and Postgraduate Studies at Masa University. He's a former Dean of Graduate School of Medicine, Perdana University, Malaysia, and former Dean of Medical Sciences at International Medical University, Malaysia. He has taught various medical faculties in India, Malaysia, USA, and UK. An ardent researcher, he has nearly 250 papers in highly indexed international peer-reviewed journals with an H index of 33, an I-10 index of 82, and more than 5,200 citations, and is involved in numerous research grants and projects. He has the distinction of publishing a journal article paper in the New England Journal of Medicine, the number one medical journal in the world, with an impact factor of a whooping 78.55. And his areas of research interest include cancer pathology, immunohistochemistry, postmortem studies, and drug toxicity studies. Prof. Srikumar is the recipient of the Academic Brilliance Awards 2013 for Excellence in Research, the Venus International Medical Award 2018 for Excellence in Pathology, Brand Laureate Award for Brand Leadership in 2018, and the Outstanding Scientist Award 2019, Ron Harden Award for Innovation in Medical Education in 2009, and was recently conferred Malaysia's Visionary Education Leader 2021. A passionate lecturer himself, he has won many awards in teaching and lecturing in his university teaching career, including the Student Choice Best Lecturer Award for consecutive years, the Teaching Excellent Award, and many more awards to add on. And he has served at various administrative capacities, including the positions as Dean, Associate Dean, Deputy Dean, Director, and Head Member, Board of Governors. His expertise includes coordinating academic programs, accreditation processes, assessments, and curriculum structure planning, review, and delivery. Today, Prof. Srikumar will be presenting 10 mysterious cases, and we're all waiting to hear from him. And I would like to pass it over to Prof. Srikumar to take over. Prof.
Thank you so much, Dr. Deepa Anbergen, for your introduction. And thank you all for being able to spend your time here today with us. And what I'm going to do today in the session is to take you through some very interesting, mysterious cases that have occurred in the medical fraternity and how doctors have handled them. And in certain situations, doctors weren't even able to come to a diagnosis. So now all these cases have been documented in various journals, especially the New England Journal of Medicine, which is where I've actually taken all these cases, and I have given references at the end of each case. Now, during the course of this talk, if you have any questions, or if I throw any questions at you for your diagnosis, and if you want to answer, please post your questions in the comments box below, and I would be able to see it right away, and then we could discuss that as well. Okay, so what I'm going to talk about is 10 mysterious medical cases that baffle doctors in a single year. Now, most of you are doctors here or medical students. So if you are actually listening to this today, let's see if you get baffled or if you get intrigued or if you get interested. Okay, so all of us read journal articles. Now, journal articles are of two categories, three categories. One is a research article where you've actually done a research. The second is an article where you've done a review. And the third is a case discussion. Now, when you go through case reports in certain journals, you'll find that case reports last only 2 or 3 pages. But as much as they are small, case reports actually describe the condition of certain individual patients. And these help doctors to better understand rare diseases And it also helps us to spot certain unusual signs of common conditions which we may mistake. So the cases that I'm going to discuss, I'll go in a countdown from maybe the best to the very best. Let's see. I leave it to you to make the choice. And these were all covered in Life Science and New England Journal of Medicine. Starting with case one. Okay. I'm in slide 2. I hope you all can see the slide. Now, what you see here is a urine catheter bag. Now, urine catheter bags aren't a hot topic of discussion. I'm not here to show you a catheter bag because it's something that all of you have seen in your hospital rounds. Now, these are used to collect hospitalized patients' urine samples. And the urine sample is always yellow. So, this is not much of a rare case unless the urine decides to turn purple. This is a very interesting case in the New England Journal of Medicine 2019, October 2019, where a woman in France who was admitted in the hospital, after 10 days of hospitalization, she saw that the urine in her catheter bag changed from a normal yellow to a purple color, in more a violet color than purple. So she was astonished, and the medical team was astonished as well. How can urine turn purple? Any guesses from your side? Anybody would like to guess? Okay. She was diagnosed with a condition, a rare condition, simply known as purple urine bag syndrome. Now, this is actually a chemical reaction that takes place in the catheter bags when the purple discoloration of urine occurs due to a coexistent urinary tract infection. So when there is a urinary tract infection that occurs, it causes a chemical reaction where it converts a chemical in the urine called intoxyl sulfate, which is actually a breakdown product of tryptophan, which is a protein in the body, into two compounds. One is red color. Okay, I just switch off the WhatsApp notification. So two compounds, one is into a red color and another is a blue colored compound. So when red and blue join together, it becomes purple. Okay, so moving on to the next slide. Yeah, so usually this is a medical syndrome where purple discoloration of urine occurs in these urinary catheters where, remember, there should be a coexistent urinary tract infection. And the bacteria uses the enzyme indoxyl sulfatase to convert indoxyl sulfate in the urine into two colors, indirubin and indigo. And the most common bacteria are Klebsiella pneumonia, Proteus mirabilis, E. coli, Pseudomonas aeruginosa, and a few others such as Providentia and Morganella species. Now, what has happened to this patient subsequently? I mean, although this is a strange looking and very dangerous looking disease, this is a benign course in terms of outcome and prognosis. But it suggests that the patient has a urinary tract infection. And fortunately, it was found that this patient had a very mild urinary tract infection, and the urine gradually returned to normal after about a few days of increasing in hydration and antibiotic therapy. So in this case, all was well that ended well. So the first case that we have seen today is called purple urine bag syndrome. I hope you're with me so far. I'm going on to the second case. Okay, we all know that Right from the ancient historical time, it was said that blue blood means royalty. Does it mean royalty? Do we have blue blood? And blood is always red, right? Now, for those of you who've done your physiology, you would know that actually blood is red, but the impure or deoxygenated blood has a bluish tinge. Even though we draw it blue in textbooks, it is just a bluish tinge. Now, this is a case, again from the New England Journal of Medicine, where a young woman in the US, Rhode Island, she came to the hospital and told doctors that she was blue. And when she said she was blue, it was actually a literal meaning because when the doctors took her into the emergency room, she was a 25-year-old lady. When doctors took her into the emergency room, she had weakness, fatigue, breathlessness, and the entire skin had a bluish discoloration, including the tongue. So when doctors drew blood from the patient's arteries, this was what was seen. The blood appeared blue rather than red. So, what do you think has happened in this case? Can a person have blue blood from the arteries? Arteries are supposed to have red blood. We move on to the next slide. Okay, this patient was diagnosed with methemoglobinemia, which is a blood disorder where hemoglobin, remember hemoglobin is the protein, it has two parts, heme and globin, that carries oxygen. So that is not effectively able to release oxygen to the tissues. So this condition causes cyanosis because there is reduced peripheral perfusion of oxygen. So cyanosis and also bluish color in the blood. Now, this can be either inherited or as a result of a medication as well. People can develop methemoglobinemia due to exposure to medications such as antibiotics, dapsone, nitrates, benzocaine, or it can also be due to an allergic reaction. In this case, when they took a history from the woman, they found that she was using a large amount of a tooth numbing medication. She was applying it in the oral mucosa, and this tooth numbing medication had absorbed through the oral mucosa and it had caused an allergic reaction, which results in methemoglobinemia. So, what is the prognosis in this case? She was treated with oxygen and intravenous methylene blue. Now, intravenous methylene blue restores the iron in the hemoglobin and it restores the person back to normal. So, is it a dangerous disease? How much of methemoglobin, methylene blue should be given? Very interestingly, even with one dose of intravenous methylene blue, the patient has significant results and significant effects. But if left untreated, the patient presents with what this patient presented with cyanosis, headache, dizziness, nausea, and if left untreated, the patient can go on into convulsions, seizures, and even ventricular arrhythmias. Okay, so the main feature in methemoglobinemia is hypoxia. Now, having said about this case, I need to tell you about two more interesting cases, the blue fugates and the blue lurgan. Blue fugates was a family which suffered from methemoglobinemia, which was presented as another case discussion. I'm just adding it here just as a form of completion for you to realize how interesting this disease is. Now, blue fugates was a couple who married and had 7 children, and both of them were carriers of the recessive methemoglobinemia gene, which is the MET-H gene. If they are recessive, they don't suffer from the disease, but their children can suffer from the disease according to the Mendelian's law of inheritance. So, as a result, 4 of the 7 children exhibited blue skin, and as the children married into the very limited community in that town in Kentucky, many more children that were being born had this MET-H gene and they were all blue. So this started in the 1820s, and until the 1960s, that town had many people who were blue. Until in 1964, all of them were treated with methylene blue and they recovered very well. But it didn't stop with that. The last descendant in 1975 was blue again, and he was treated again with methylene blue and he recovered. So that is another story that ended well after 140 years. The other story is that of Blue Men of Lurgan in 1920. Lurgan is a place in Ireland, and they had a lot of blue men there. And when they did a gene analysis, they found that all of them had familial myth-H. Again, this was a case where, a situation where they found that probably they were children of people who were carriers of the recessive gene, and they were treated, and everything ended well. So, this is another story that ended well. So this is a picture taken from the journal. The references are behind the comments box, so it's hidden from you. And on the left side, you see a patient with hemoglobin high, where you see the tongue is also cyanotic, the lips are cyanotic, and so is the forehead and the cheek, and a little bit of the neck as well. On the right side, as soon as the patient has been treated with methylene blue and ascorbic acid, there is a significant improvement. So, such a big sounding disease has such a wonderful, immediate, rapid treatment. Okay, so we move on to the next case. I hope you guys are with me so far. We've done two interesting cases, and we move on to a third case of a person who presented to the hospital with mysterious intoxication. Now, as you all know, the main feature, the main chemical that causes intoxication is alcohol. Of course, there are other forms of intoxication, but intoxication is caused by alcohol. This person was brought to the hospital because he had very high levels of blood alcohol. But he swore that he never consumed alcohol, and the doctors refused to believe him. So would you, so would I. If somebody comes with a breath of alcohol and tells that he swears that he never consumed alcohol, I would never believe him because I can smell the alcohol. And so would you. And moreover, every alcoholic says that he doesn't drink. So this guy also appeared drunk. Not only did he appear drunk, but his alcohol level was very high. Okay, and when the police checked his alcohol level, they found that it was high as well. So this is a case again from New England Journal of Medicine, where a 46-year-old man experienced episodes of a mysterious drunkenness, which was first reported in BMJ Open Gastroenterology and then later mentioned in New England Journal of Medicine itself. So when he had these episodes of mysterious drunkenness, he exhibited mental changes, brain fog, and slurred speech, and aggressive behavior. And one day he was arrested for drunken driving. And when the police checked his blood alcohol level, they found that it was twice that of the legitimate limit. And all the while he said, "No, I don't drink. I've never consumed alcohol in my life." Very interesting, right? So, what do you think is happening? We move on to the next slide. Okay. This man was diagnosed with auto brewery syndrome, ABS, which is a very rare condition where the microorganisms in the gut, in the intestine, they ferment carbohydrates into alcohol. We all have carbohydrates in the intestine. What we eat consists of proteins, carbohydrates, and fat. The carbohydrate that goes down into the stomach gets converted to alcohol. Well, how can this happen? Very interestingly, this man had strains of a particular type of yeast which was living in his intestine that converts carbohydrates to alcohol. So, there are quite a few cases of auto brewery syndrome in the last several cases, but this medical condition has been mentioned in the news a few times. In most of the cases, this involve people who are arrested for drinking and driving. And when a person is arrested for drinking and driving, everybody would say, "No, I haven't been drinking." But in such cases, it has seriously happened. This man has been driving but hasn't been drinking. Okay, incidentally, another case report of a woman was found to have the condition after she was arrested for drunk driving in New York. Her blood alcohol level was 4 times the legal limit, but she wasn't charged because her medical test showed that auto brewery syndrome raised her blood alcohol levels. Okay, remember, this is a very rare medical condition where the ethanol that is produced in the intestine is at intoxicating level, and it undergoes a fermentation in the digestive system. So we call this endogenous fermentation. And there are numerous organisms, yeast and bacteria. I think I have that in my next slide. Yeah, there are numerous organisms, including Saccharomyces, Candida albicans, different types of Candida, Klebsiella pneumonia, Enterococcus faecium, and all these organisms they use lactic acid fermentation or mixed acid fermentation pathways, and that will produce an ethanol end product. And this ethanol that is generated will cause increased blood alcohol concentrations, and that will produce the effect of intoxication without the consumption of alcohol. Now, there are many researchers who have done a lot of research papers on this, and they felt that the underlying cause is probably prolonged antibiotic use by which the normal gut bacteria get destroyed, or poor nutrition, or people who have increased carbohydrates in their diet, or those who have other conditions such as diabetes or any liver disorder by which there is improper liver enzyme activity. Okay, so this is a case of a rare case of auto brewery syndrome. Very interesting case. Huh? If you think this is rare, I'm sure you agree this is rare. If you think this is rare, in the next slide, I'm going to show you something which is even similar to this but even more rarer. Only one case has been described in medical history so far. This is called urinary autobrewery syndrome. So far, only one case has been recorded, and that in 2020 in this medical journal. A 61-year-old woman with diabetes in the US is the first documented case where autobrewery syndrome occurs in the urinary bladder. So, in the bladder, the urine is converting into alcohol because of the yeast that is fermenting in the bladder. And this fermentation of the yeast, which is Saccharomyces, converts the glucose in the bladder to ethanol, which means this lady had so much of sugar levels that the urine sugar was so much that in the bladder, when it was being uh, stored, it was getting converted to alcohol. So she was passing urine, which was nothing but passing alcohol. Okay, so this is case 3 for you. And case 3 I've actually shared as 2 cases, which is the auto brewery syndrome, and the second part, urinary auto brewery syndrome. Okay, so we move on to case 4. I hope you guys are with me so far, and I hope you find the next case as interesting as this case. I move on to the next slide. Okay, now I'm sure a lot of you like avocados. So do I. I have avocados regularly. Science and health says that avocados have healthy fat, and in most places in the US, avocados are part of every sandwich. Every veg sandwich that you have usually contains avocado slices in it. When avocado is minced or when it is made into pulp, it is just seen as a green food. This journal article in BMJ case reports tells about a 60-year-old woman who attended a wedding where she saw avocados and she liked it so much, so she ate a large amount of avocados. But a few minutes later, she felt a sudden pressure in her chest, which radiated to her arms. What do you think has happened? Do you think the avocado would have caused an overload? Any comments in the box so far? No comments? What do you think the avocado would have done to this patient? Think about it for a few seconds and I'll get back to you. Enlarged and weak that it can't pump properly. Why has this happened to this lady? Very interestingly, when the doctors did a history check, they found out what had happened to her, whether she was exposed to any trauma or eaten anything. They found that she ate a large amount of avocado. And when they counter checked this with the people in the wedding, what she ate was not avocado but wasabi. And when minced, wasabi and avocado both look the same green food and they can be confused. So this lady has eaten a large amount of wasabi, and this wasabi has caused a stress, and that has resulted in this woman's syndrome. What is the syndrome? I move on to the next slide. What she suffered is a condition called Takatsubo cardiomyopathy or Takatsubo syndrome. Any guesses as to who Takatsubo is? Is he the inventor of, is he the discoverer of this cardiomyopathy? Was this cardiomyopathy named after him? Very interestingly, Takatsubo comes from the Japanese word meaning octopus trap, because in those days when the Japanese used to fish for octopus, they used to have a jar with a wide body and a narrow mouth. And the octopus they used to keep a bait inside. The octopus used to go and sit in the trap and they used to lift up the trap. I will show the trap to you in the next slide so you'll understand how the heart dilates like the trap. So this is a case of non-ischemic cardiomyopathy. Remember, there are various types of cardiomyopathy which you've done in your medical school, and dilated, hypertrophic, obstructive, restrictive. This type of cardiomyopathy is non-ischemic, where the myocardium undergoes a temporary weakening, and this usually occurs after a stressor. And the stressing substance in this case would have been the wasabi which this person has eaten. And a lot of stressful substances can cause this. It could be sepsis, shock, or the adrenal tumor, pheochromocytoma, and any emotional stressors. It could mean even be a death in the family, loss of a job, or a divorce, or well, a divorce is time to rejoice, but even that is a stress. And different aspects of stress can actually cause this Takatsubo non-ischemic cardiomyopathy. Okay, now I move on to the next slide to help you understand this better. Now, what you see in the middle figure is how the heart has dilated so much that the wall of the ventricle is narrowed, and it resembles a Japanese octopus trap. And what you see below is a Japanese octopus trap. And if you see, it has a wide body and a narrow mouth. Now, the pathophysiology of Takotsubo syndrome is not very well understood, but probably because during stress or in pheochromocytoma, for example, the tumor that I told you about in the previous slide, there is a massive surge of catecholamines. Now, what are the catecholamines? Adrenaline and noradrenaline, and norepinephrine. Okay, so this could be from the extreme stress of a tumor that secretes the chemicals, and this will stimulate the cardiac muscles directly, and that can have a toxic effect on the heart. And we call this stunning of the heart muscle. The heart muscle gets stunned, so it doesn't function, so it triggers the muscle to tighten, and that can also cause a spasm of the coronary artery also, and that can affect the blood flow in the heart. So what happens? If you see this picture, the cardiac the ventricular wall is dilated, and when it dilates, it can lead to congestive heart failure. And so every time a dilated ventricle causes ventricular systole, very little of blood goes to the periphery. Okay, So, incidentally, as much as this has a Japanese name, this condition is one of the causes listed in the textbooks as one of the causes of acute coronary syndrome in many hospitals. And it will have the same complications as other forms of cardiomyopathy, which is heart failure, pulmonary edema, stroke. Okay, so as much as I'm still in the previous case, the slide has moved to the next case. So you know that the next case is going to be more interesting than the previous case. But let me finish a little more of the from Takatsubo cardiomyopathy. In this case, this patient, fortunately for her, the condition was temporary, and she recovered after 1 month of treatment. So all the 4 cases discussed so far, all of them had good endings, and the patient went home successfully. Okay, we move on to the next case, case number 5, and I actually start this case with an X-ray or a radiograph that actually shows you the pelvic girdle and anterior-posterior view radiograph of the pelvic girdle. I'm going to give you a few seconds to actually see what's visible in the X-ray, and then we'll take it from there. Okay, this is an interesting case. This is case number 5 today. Huh? We have got case number 5 out of 10 cases. This is a case from urology case reports. The body grows bone everywhere. Sometimes it grows bone in places where it shouldn't. There was this elderly man who presented to the hospital, a 63-year-old man who presented to the hospital, who presented not for any other reason but because he had a fall on the road and he had pain in the hip and in the knee, and he went to the hospital and they took an X-ray to see if his hip joint and the knee was okay, whether he had any fracture, and everything was okay. But the doctors discovered that his penis was ossified. The entire shaft of the penis, as you see in the zoom in picture on the right side, you can see an ossified part. I hope you can see the mouse pointer. This whole part of the penis was ossified. Okay, so now this man was diagnosed with ossification of the penis or penile ossification. Now, what is this disease? Now, there are about 40 case reports in medical literature regarding ossification of the penis. Now, ossification happens when in any part of the body, ossification happens when calcium salt builds up in soft tissues. And when calcium builds up in soft tissues, it leads to bone formation. Okay? So, moving on to next slide. So, when does calcium build up in soft tissue? Calcium salts build up in soft tissue in any condition when there is excess calcium in the blood. And when is there an excess calcium in the blood? Sometimes excess calcium occurs when there is a malignancy, and this malignancy metastasizes to the bone. So when malignant tumor cells eat into bone, the bone calcium is released. It goes into the bloodstream. That will cause hypercalcemia, and that can cause excess calcium deposition in various parts of the body. And it could be hypercalcemia due to paraneoplastic syndrome. There are many paraneoplastic syndromes we've all read about in lung cancers, where endocrinological disturbances occur due to a malignancy. Other metabolic diseases or end-stage renal disease, where due to renal failure and stimulation of the hyperparathyroidism, there can be a hypercalcemia. Again, all endocrinological mechanisms. Okay, so in this case, when very interestingly, what happened to this patient? When the doctors told this patient that he had ossification of the penis, and they said that they wanted to admit him further for investigations, the patient decided not to be investigated, and he decided to leave against medical advice because he felt he was happy and comfortable with the calcified penis that he already had. Okay, now one of the differential diagnoses for a penile calcification is penile calcification or ossification can be mistaken for Peyronie disease, which is in the lower part of the slide. And one of the differential diagnoses for penile calcification or ossification is also Peyronie's disease. Now, Peyronie's disease is also called by all these names that I've listed: plastic induration, fibrous sclerosis, and fibrous cavernocytis. And when the person gets an erection, it is painful. The penis is distorted, it will be bent, and the erect penis will be constricted. Now, when you do a histopathology, a pathology of this, now I'll start from the right side. When the penis is erect, this is how it bends during erection. And there is fibrosis in the corpora cavernosa and the tunica albuginea, and you can see areas of ossification in the septum in the radiograph. And grossly, all these are the ossified hard tissue which have been surgically removed, and microscopically, all this is the area of calcification. Now, if you remember your basic sciences and pathology, you would realize that this is the same calcification that you would see in an atheromatous plaque in the coronary artery. So if I'm given this picture and don't say that this is the penis, you may think this is a calcification in atherosclerosis in the coronary artery. So this is a case of calcification which is seen in Peyronie's disease. So Peyronie's disease is a differential diagnosis in this case of ossification of the penis. Okay. Thank you so much so far, and I'm going on to case number 6. And case number 6 is when a person's chest caught fire. Can your chest catch fire? Think about it. Can it? Well, some of you who have been into medicine since the latter part of last century would realize there is something called spontaneous human combustion, where a person can suddenly catch fire, or a body immediately after death can suddenly catch fire. If you Google spontaneous human combustion, or if you wiki spontaneous human combustion, you would get a lot of theories about spontaneous human combustion, some of which are even supernatural theories. But I'm not here today to discuss about spontaneous human combustion. Today, I'm going to talk about a person who was being operated for a heart surgery whose chest caught fire. A very rare surgical complication. Let's move on to the next slide. Okay. Now, a 60-year-old man, this case was from the European Society of Anesthesiology Journal. A 60-year-old man needed a surgery for a rupture. You all know that the aorta runs from the heart through the thorax. The arch of the aorta runs through the thorax. The thoracic aorta goes on to the abdomen as the abdominal aorta. And in obese people and in people who have unhealthy lifestyle, the aorta can form an aneurysm. So this man had an aneurysm and he had to get this life-threatening tear fixed. So he was posted for surgery. And this happened in Australia. And it was an unusual case because this man had an unusual, complicated history. In addition to his aneurysm, this person also had a COPD, chronic obstructive pulmonary disease. Okay. Now, a COPD will cause the lung to develop bullae. Let me show you a picture of a bulla in the next slide. Now, this is a lung which shows numerous bullae. Bullae are large empty spaces in the lung. You can see it in the left side of the lung. This lung has a lot of bullae. Okay. So, this guy actually had gone in for a surgery. They knew that he had a history of chronic obstructive pulmonary disease. And during the surgery, the doctors used an electrocautery device, which you all know, used by surgeons these days, which heats tissue with electricity to stop blood vessels from bleeding. And suddenly, sparks from the electrocautery device ignited a fire. How can a fire be ignited? The anesthetist, now I'm shifting from the surgeon to the anesthetist. The anesthetist realized that the patient had COPD. So before the surgery, he wanted to ensure that the patient can breathe properly. So he increased the amount of oxygen in the patient's anesthesia. So when oxygen increases, and the surgeon's surgical tool is producing a spark. The spark plus the combination of the oxygen caused the man's chest and the bulle, the extra oxygen, to catch fire, and his chest went on fire. So, incredibly, the surgical team was. Let me move on to the next slide. Sorry. Okay. The surgical team actually went on not only to extinguish the fire but successfully completed the surgery and brought him out alive out of the surgery. So, how did they douse the fire? They used saline, salt water without injury to the patient, and with gauzes, they suppressed the fire. Okay. So, what is even more interesting is this isn't the first time that a patient's chest has caught fire, and this has been reported in 6 case reports in journals before. So, this was the 7th case reported so far in the past 150 years. So, what does this mean? Which means that there are a few documented cases of chest cavity fires, and all of them involved cardiac and cardiothoracic surgery. So what does this mean? This means that in future, surgeons and anesthetists should be trained to even put out fires, and if there are fires in the chest cavity and lung is damaged, they need to take proper precautions. Okay, so okay, the moral of the story is when you do a cardiothoracic surgery, and remember that dry surgical packs, electrocautery, increased oxygen concentration, patient with COPD, all this can lead to a chest fire occurring during a surgery. Okay, I move on to the next case. This is case number 7, and I hope you can see this case here. And this shows a toe and a small line here. And when you zoom in, you can see this line here. Now, again, I'm giving you a few seconds to go through this before I start discussing this case. Okay, this is. Any comments so far? No comments in the box below, so I continue. A fallen strand of hair. All of us have fallen strands of hair at home. It's harmless enough. But in rare cases, a loose hair can go and get embedded in the skin, and we call this a hair splinter. Now, for those cardiologists out here, you've heard of splinter hemorrhages, which are, you can see hemorrhages like a splinter beneath the fingers. But in this case, this is called a hair splinter. This is a case where was documented in the Journal of Emergency Medicine, where, let me move on to the next slide, where a 35-year-old man in Brazil went with a mysterious pain in his right heel, which got worse when he walked. And the doctors couldn't see anything wrong, but they found a single strand of hair under when they used a lens. And this man, I'll tell you the microscopy, because before I move to the diagnosis, this man, you can see that a microscopy histopathology was done, where you see the epidermis, the dermis, and in the dermis, you can see a hair fragment in an empty space. This is a condition called cutaneous pili migrans. And since 1957, only 26 cases of cutaneous pili migrans have been described. The etiology remains unclear. In this case, the person's hair measured only 10 millimeters, and the person was relieved after the hair was removed using minor surgical procedures. Now, as rare as this can be, the differential diagnosis of this cutaneous pili migrans is a condition which is slightly more common but more interesting. It's still part of this case, but I'm going to tell you a differential diagnosis. Moving on to the next slide. Okay. A cutaneous pili migrans differential diagnosis is a pilonidal cyst. Now, what is a pilonidal cyst? I'm sure all of you, when you've done your surgery posting, you would have had pilonidal cyst as one of your minor cases that you need to study. World over, it is common. Pilonidal cyst is there in all textbooks, especially in USMLE books, because it is a common disease in the US. Why is it common disease in the US? It is actually the people in that part of the world are at a higher risk. I'll tell you why later, but first to tell you, you can see this sinus in the buttock region, in the gluteal region. Now, a pilonidal sinus is actually a round sac of tissue that is filled with either air or pus. Now, usually it occurs in the buttock, very common in the US, but people are so embarrassed that they don't even go to the doctor for it. Okay? Very interestingly, during the World War II, pilonidal cysts were very common and they were called as jeep driver's disease because the people driving the jeeps used to get this disease. Now, as they drove a jeep, the hair from here used to fall and go down into the pant and sit between the two gluteal clefts, between the buttocks, and burrow inside between the buttocks, the cleavage of the buttocks. And the hair used to go there and cause this sinus that you see in the picture here. Okay, so now anyone can get a pilonidal cyst, but in terms of risk factors, it is more common among the obese, more common in the men and overweight people, people with thick body hair, and people who wear tight clothing, and those who are always driving, jeep drivers, bus drivers, and so on. Okay, so I finished with case 7 and I'm entering case 8. I've got 3 more cases, case 8, 9, and 10. And I hope you all are okay so far. And if you have any questions or comments, please post your comments in the comments box below, or you can actually post them into the live chat on Facebook and YouTube, which is going on right now. Okay. This is a case from the Annals of Internal Medicine 2019. Blinding diet. When you see French fries, you're blinded with delight. Wow, I'm going to have these French fries. When you see pizza, you're blinded with delight. Wow, I'm having pizza and I'm so happy about it. I'm blinded to everything else. I'm thinking only of the pizza right now. But as much as you're blinded with delight with junk food isn't bad only for the heart, but it can be bad for the eyes. This is an interesting case of a 15-year-old British teenager who ate so much of junk food that it made him blind. Interesting? I'll move on to the next slide to explain this. A 14-year-old British teenager, okay, it is a 15-year-old teenager who presented with 1 year history of eating junk food since he was 14. And all he ate was things like French fries, white bread, chips, processed food, processed cheese, processed sausages, processed ham slices, everything. And he ate only this. And then in this 1 year, he developed a hearing loss and vision problems. And when he came to the doctor checked his eyes and said, and legally confirmed that he is blind. They did an ophthalmoscopy and they found that the optic nerve was damaged. Now, if the optic nerve is damaged, that's it. It is nerve damage and the sight cannot be restored. So, this person was diagnosed with optic neuropathy, more specifically, nutritional optic neuropathy, where the optic nerve loses its function because of improper eating of food, lack of essential nutrients, which affects the optic nerve. Most commonly due to folic acid and B complex deficiency, and it could be due to malnutrition, poor dietary habits, or vegetarian or vegan diet, or chronic alcohol abuse. Now, wait a minute, I'm really scared now because I am a vegetarian myself, and the past 1 year I'm a vegan. Am I at a risk for optic neuropathy? Now, a small correction. One of the risk factors is incorrectly applied vegetarian diet or incorrectly applied vegan diet. Vegetarians and vegans, as long as you ensure that you have your folic acid and B complex through other sources, it should be okay. So, what is this optic neuropathy? Due to nutrition, it is painless and gradually progressing. The person doesn't realize that he is getting blind. Okay, and the best way to treat this person is to compensate the nutritional disorders by giving folic acid, B complex, protein replacements. Okay, is this rare or common? As much as I'm focusing on diseases that are not very common, uh, nutritional optic neuropathy is now slowly becoming common. Why? Because of increase in vegetarian and vegan diets world over and widespread use of bariatric surgery. Now, a lot of people are going in for bariatric surgery. Bariatric surgery is a form of treatment for diabetes, for weight loss, and to prevent to prevent the spikes in blood sugar. And bariatric surgery is being used by a lot of film stars and celebrities to cut down their weight. So all these people have a chance of developing a nutritional optic neuropathy. Okay, there's one more case which is similar to this, which I'm sharing, which is that of a young woman in whom chronic use of water-based diet resulted in anemia and bilateral nutrition optic neuropathy. This was also another journal article which said about a woman who just drank predominantly water in trying to cut down her weight and in trying to maintain a healthier lifestyle and so on, but she went overboard and she developed bilateral optic neuropathy. This was another example where a person had optic neuropathy without alcohol abuse. Now, very interestingly, in alcohol abuse, there are two reasons for optic neuropathy. One is the alcohol itself destroying the optic nerve. And the second is a person who consumes alcohol will not eat properly because he will want to drink more than he eats. And among the people in the low socioeconomic group, they spend more money on alcohol than on food, so they cut out on the food. So these are all the various factors that contribute to alcohol abuse optic neuropathy. Okay, we move on to the next slide. In case you have lost count, this is case number 9. Okay, and you see the picture here. You can see that the iris has collapsed and formed a small heart-shaped symbol here. Now, can the iris collapse? The iris is fixed to the ciliary body. So much so that even in post-mortem, it is difficult to pull out the iris from the ciliary body. But this is a case from the New England Journal of Medicine where this man, an adventurous man, went for bungee jumping. And as you all know, bungee jumping is an exciting adventure sport where you jump from a building, where jump from a bridge, you're tied to a bungee and it comes down. You almost hit the water, which is several hundred feet down, and you come up again. In the trauma of jumping down and going up in the bungee, his iris collapsed. And he didn't realize that. He just reported pain and double vision in his eye. And then he went to the doctor, and when the doctor saw, and at that time he recollected that the bungee cord hit him also when he came up. Moving on to the next slide to tell you the diagnosis. He was diagnosed with this condition, traumatic iridodialysis. This is a type of injury that happens when a blunt trauma hits the eye and that causes the iris root and the ciliary body to detach. So what happens when the iris root detaches from the ciliary body? Now, if you all remember, the eye has two parts filled with liquid, the aqueous humor in front and the vitreous humor behind. And there should be a balance between these two fluid levels. If there is no balance, the intraocular tension rises, and that causes glaucoma. So this is one of the examples of traumatic glaucoma or glaucoma induced by a trauma where a separation between the iris root and the ciliary body causes a glaucoma. So traumatic iridodialysis has two phases, acute and chronic phase. I've described that in this, and this is from a textbook. But the main feature in an acute phase is a high fema. High fema is accumulation of blood in the anterior chamber of the eye. and the iris gets inflamed. So initially the intraocular pressure reduces, but later it increases. And in chronic case, there is a visual field loss and the pressure elevation leading to glaucoma as well. So, however, in this case, he was lucky because he was treated with anti-glaucoma agents, and surgical repair of his iridodialysis was done. Okay, now this is the iris that has been damaged, and this is high fema. High fema is a medical term for blood in the iris. Okay, so we've almost done an hour now, and have I done the 10 cases? Well, I have finished 9 cases, and I'm in the 10th case now, and I'm going to talk a little bit on bloodletting. Bloodletting is one of medicine's oldest practices. Bloodletting was thought to be originated in Egypt. But in India, ancient Indians claimed that they let blood before, even earlier than the Egyptians. Some of the scriptures say that they used to tie a tourniquet and cut the cubital vein to let out blood. But in Greece, there were many physicians in Greece who used to let out blood. And as early as 3rd century BC, but 300 years before uh, Julius Caesar, before the Romans and Jesus era, bloodletting was common in Greece as well, because the Greeks believed that all diseases is because of overabundance of blood in the body. Okay, they call it plethora. That's why patients with suffering from polycythemia vera are said to have plethora. Plethora is increased color in the face and in the gums and so on. Talking about polycythemia vera was described only 100 years ago. Before that, these people who suffer from polycythemia vera used to have so much of plethora that they had this buzzing sensation. The face, eyes were bloodshot because of increased hemoglobin, and their gums were bleeding because of again increased hemoglobin. And bleeding gums, they were scared, and they were named as Draculas or vampires. So, my dear participants, doctors, for those of you who heard of the history or stories or legends of vampires, they are nothing but people suffering from polycythemia vera who did not have a term describing the disease 100 or 200 years ago. Okay, so coming back to this case. Now, this is an interesting case of a 39-year-old man with diabetes. And he was, this is a case from Annals of Internal Medicine. As you see, I mean, I've given all my references below there, but they're hidden by your comment box. So, um, in fact, yeah. So in all my slides, you would have seen these references down here, but unfortunately, the comments box have been hiding these. Now, this 39-year-old man had diabetes, but he wasn't taking his medications regularly. So he came to the presented to the emergency room with nausea, vomiting, headache, loss of consciousness, altered sensorium, and so on. So the doctor took out the nurse took the blood, and this is what the blood looked like. Is there any blood here? It looks just like milk in this slide. Okay, so friends and doctors, normal triglyceride level is 150 milligram per dl for all of us. You say the patient has hypertriglyceridemia when the triglyceride level goes up to 500 milligram per dl. That is when, if you happen to go to a cardiologist, the cardiologist would tell you, put you on statins, and the cardiologist would also tell you that, no, I need to do an angio, you may need a bypass, and so on. So you're already at a risk. So remember these numbers, 150 mg is a normal value, 500 mg is the value for hypertriglyceridemia. This patient triglyceride level was 14,000 milligram per dl. 150, 500, 14,000. He shouldn't be living at all, he should be dead. So what did they do? Moving on to the next slide. Usually, when there is hypertriglyceridemia, they do a plasmapheresis, where you sit in a plasmapheresis machine, blood is taken out from the body through one hand, passed through the plasmapheresis machine, the triglycerides are filtered out, the remaining blood is brought back into the body. Usually, one episode of plasmapheresis will bring down the triglyceride level by 70%. So they tried it on this patient. Was it successful? Unfortunately, his triglyceride level was so high that the triglycerides clogged the entire machine and the machine stopped working. At this point, they were not worried about the machine. The plasmapheresis machine is like a dialysis machine. It's really, really expensive. But at this point, machine clogged, they're not worried about machine. They have to save this guy. Immediately, they took out scalpel and they did a manual bloodletting, and they removed his blood and the high triglyceride levels. And this was described in this article. This is the article that describes manual bloodletting for high triglycerides. The first ever case of manual bloodletting after the Egyptian era, the Greek era, and the Indian era. Bloodletting was done to treat severe hypertriglyceridemia in this case. Okay. So, well, we've gone live for 1 hour and 1 minute now, and I've finished 10 cases. Well, it's always nice to finish 10 cases, but when you say bye, you always wish you had 11th case to sum up. So, well, which is what I'm going to do. I'm going to sum up with the 11th case. Now, this is a very interesting case, which is a case where the heart was pierced. We all know that when a person falls in love, Cupid shoots his arrow and the arrow hits the heart. It pierces the heart. And that's how a heart falls in love. But this is a case where a young boy, 17-year-old boy, went to the emergency room with a sharp chest pain, radiated to the back. For all of you who've done your surgical posting, you would have realized that chest pain radiating to the back can signify pancreatitis, acute pancreatitis. But every time he took a deep breath, the pain increased. So the doctors did an ECG. There was an abnormal rhythm. So the doctors diagnosed the boy with either pericarditis or myocarditis. So they found that his grade CKMB was raised. When your CK and CKMB are raised, it means you're probably going to have a heart attack. So they did a CT scan. When they did a CT scan, they found a linear metallic foreign object in the boy's heart. Now, what could this object be? So they did a history taking, and that boy said that he does tailoring of clothes, and recently, while tailoring the clothes, he was holding a pin between his teeth, and he feels that he may have swallowed the pin in his mouth. Now, how can a pin from the mouth go to the heart? It should go to the stomach. So, anyway, the doctors did an open heart surgery, and in the heart, in the pericardium and myocardium, they found a sewing pin. It is the same pin that the boy swallowed. Now, you tell me, how did a sewing pin from the mouth go into the heart? The doctors are still baffled. They feel that in this case, the pin probably traveled from his stomach through the heart as a direct traumatic movement through the layers of the stomach, through the glands, through the muscle layer, and through the peritoneum, through the diaphragm to the heart. Or it could have been from any other location in the gastrointestinal tract. Okay. So among the 10 cases that I have discussed, this is the 11th case. This is the first case that is still a mystery, and the doctors did know how a pin has gone into the heart from the mouth. However, the authors who wrote this article also have given guidelines that we need to think of new implications for sharp objects that are swallowed. Children play with sharp objects and toys. If they swallow it, all this while textbooks say that you'll actually need to do an ultrasound, you need to do an endoscopy or take out the stuff from the stomach and all that. But this article has given us a new insight that things can travel even beyond the stomach into other parts of the body, and it can lead to even more life-threatening complications, even in the absence of symptoms. So what happened to this boy? This boy was operated, fully recovered, and he is back home, and he is still doing his tailoring without any further complications. Okay, so this is. Oh, I've stopped this slide, but I don't see my camera here. So I stop with this, and I hope you enjoyed these 10 cases. Now, each of these 10 cases are interesting in their own way because each of these baffled the doctors, and they had to sit together for various meetings in their committees, in their CMEs and discussions before they came at a diagnosis. This is where it shows that all diagnoses are based on teamwork, and this is where it shows that you need not just doctors but investigations and so many other aspects to make a diagnosis. And remember, if all your doctors make a rare diagnosis, please don't just stop with that. Please make sure that you write it up as a case report and publish it. Okay, so thank you very much once again for this opportunity, and I pass the mic over back to Dr. Deepa Anbaragan.
Thank you so much for that interesting and in fact, all the cases that you discussed were really mysterious, and many comments in the box there telling that very interesting cases, and some people put "Oh my God" there, and a few questions for you, Prof. So there's one question from Dr. Sudha. This is on the first case, the lady with the purple urine. So in the first case, does the urine color change after collection, or she passed purple urine? Were there
Okay,
any other associated conditions in her?
okay. Thank you for this question. It changes after collection because they noticed it only in the back. So because it is the patient's urine turning after the reaction occurs in the back. There were no other associated conditions. People with urinary tract infection with the bacteria that I have listed are prone to developing this. Again, this is a very rare condition. Yeah, I hope I answered your question.
Yes, Prof. Again, Dr. Sudha Armugam, she's asked about case 3, I think. It was mysterious
Okay.
intoxication, the auto brewery syndrome. So what is the
Okay.
prognosis of auto brewery syndrome? Do they develop alcoholic liver disease and other effects of chronic alcoholism?
Okay. Now, there are very few cases of auto brewery syndrome that have been diagnosed, and in all these cases, it has been episodic. So, for an alcoholic liver disease, it has to be a chronic process. Number two one, this happens in the intestine below the level of the duodenojejunal, below the level of the C of the duodenum. If it happens at or above the level of the duodenum, it will affect the liver. Now, it doesn't move into the liver or the bloodstream towards the liver at all. When alcohol is taken in, it is metabolized in the liver. This alcohol escapes the liver. Yeah.
Prof, I
And
mean,
yeah.
yes, please go ahead.
Chronic alcoholism, these are episodic cases. And so rare that even textbooks haven't understood the concepts yet. Yeah.
Yeah. So you mean to say the alcohol levels that's produced by the fermentation of these microbes is so much overloaded that the body is not able to convert the alcohol?
Now, this alcohol moves out into the bloodstream and out into the. Now, the first movement of alcohol in the plasma is through the capillaries in the lung. That's why you have an alcoholic breath. So these people have the effect of the alcohol in the blood and in the lungs, and it intoxicates them at that moment, episodic, but not always. That is only when the gut bacteria are active. But it is not significant enough to load the liver because it is not alcohol that has been drunk. It is not actual raw alcohol. It is just the carbohydrates that have been converted to alcohol, which probably would go through the liver but wouldn't cause a significant liver damage.
Yeah. And also, do you think that it's going to be a transient effect because it's only because of an altered microbial flora of the bowel, of the
Yes,
intestine?
yes. In many of these cases, from what I understand, the reading I did, these people were given antibiotics against specific organisms, and they were given probiotic diet, and they were given lifestyle changes, and there was some significant improvement.
Okay. So it's mainly, if it's the antibiotics, and probably it's the fungus that's growing, right? Like
Yes,
Saccharomyces, and
probably
and,
yes.
and definitely
And
it's going to be
history of
transferred.
antibiotic, diabetes, and all that as well. Yeah.
Okay, Prof. So thank you for that, Prof. And many of them have posted very interesting. Dr. Devi, Prof. Bashar. Thank you, Prof. Shri Kumar, and
Yeah, OMG.
yeah,
Thank
OMG for your. I
you,
think it was
Prof.
for the previous last before case. I think he put that. Yeah, and very
Thank you.
interesting from Dr. Devi and Dr. Madhu also telling it's very interesting. Yeah, they were all very interesting, Prof. Indeed, and thank you so much for
Thank
taking your time to present in our CME, and hope to have you again with another interesting topic in the next CME.
you. Thank you so much.
Thank you so much. Thanks.
Thanks to the dean and thanks to the organizing committee of the CME. As always, everything was efficient and perfect.
Thank you so much, bro. And thank you to all who got connected with us live, and many more who will be watching it after it's being recorded. So I would like to request all of you to mark your attendance. I have sent the link through all medical mail and also posted in the comment box here. So with that, we come to the end of an interesting CME event today, and hope to see you all in the next event. Thank you, all of you, and have a good day. Thank you.